Did you know that flirt is responsible for the rise in cases of COVID-19 in India as well as in Singapore? Flirt, F-L-I-R-T, is the name that has been given for the lineages that are coming from the JN.1 variant of Omicron. KP1 and KP2 are together being named as flirt for the kind of properties these variants carry. In Singapore, in fact, they are leading to a rise of about 25,000 cases a day between May 5th and May 11th. And that is why the Singapore government has said that masks need to come back over there. But what's the situation in India? The INSACOG has recorded about 290 cases of flirt led by KP1 and KP2 variants, out of which 148 cases have been recorded just in Maharashtra, the highest in the country. But other states are also not immune. There are cases in West Bengal, in Goa, in Madhya Pradesh, as well as in Delhi and many other states. The WHO is closely watching this variant, but the doctors and experts say that COVID is cyclical in nature, and that is why it may just come and go. But the properties of flirt or KP1 and KP2 variant is not very different from the earlier JN1 Omicron sublineage. And one will have to wait and see what kind of effect or impact it has on people once they are getting affected. Epidemiologists say that yes, people are turning positive, but there is no need to panic as the numbers are currently very, very low. Here's what doctors explain.
In several countries around the world, there is a rise in COVID cases at this time. The cases are not reported to be more severe and hospitalizations are not overwhelming. But people are testing positive and India is no exception. India's most recent wave had come in December last year and it had subsided by the new year. But within approximately 3 months, India has faced one more wave of COVID, which is minor at this time, and this time it is driven by what is called the KP.2 variant, which is basically a downstream descendant of the previous variant JN.1 that came to India in December. KP.2 is part of what is called the FLIRT lineage, which is a short form for two specific mutations that occur in this particular sublineage, F456L and the R346T. Now, these are two distinct mutations which appear to give this sublineage extra immune evasiveness and some transmission advantage. As a result, both these variants have displaced all other previously circulating sublineages, and that has been the trend for COVID from the beginning. When a new variant appears, the older ones settle down. In this case, the new variants are in fact downstream descendants, or if you will, great-grandsons or great-granddaughters of the previously circulating variant. All of these are part of the Omicron clan, which distinctly are less severe than the Delta that caused severe disease all around the world, including India in 2021. Thanks to extensive vaccination and also from natural immunity among people who have survived natural infection in the past, the destructive power of COVID appears to have diminished. Also partly due to the milder versions of the variants that are in circulation at this time. COVID will remain a cyclical disease, which means that it will continue to come in waves separated by periods of relative quiet. This is different from an endemic disease, which is a situation where, for example, in malaria, the disease is continuously present in a geographical region. COVID does not behave like that. It tends to come in waves, peak after a few weeks, settle down, and then go away until the next wave. The gap between the waves has been inconsistent, and there's no way to predict when a next wave will come and how severe that would be. We hope that the future waves will also remain as benign as the recent 2 or 3 waves of COVID. Singapore is a country that has consistently reported their COVID cases from the beginning of the pandemic. They have kept close track of their cases, and recently they have reported a rise in COVID cases and also a slight rise in hospitalizations. Now, Singapore is a relatively small nation and their hospital beds are limited, and therefore they're concerned that unless early steps are taken to stop the spread of this virus, the hospital beds could become overwhelmed. they are staying 2 steps ahead by planning ahead to reduce the hospital burden of both COVID cases and also to free up hospital beds in case a surge in cases occurs in the future. And that is an example of advanced planning. There are no indications that the variants circulating in Singapore are different from that circulating in India or in the US or in other parts of the world. Specifically, they have mentioned that there is no increase in severity in their observation. In Singapore, they have advised the public to wear masks, and masks are effective against airborne viruses, especially in crowded, closed, ill-ventilated indoor spaces. While wearing a mask on a beach is not necessary, if we are trapped in a small room with many people who are continuously talking and the room is not well ventilated, it would be helpful to wear a mask to protect ourselves and others, especially during times of a COVID surge.